Welcome to the Dr. Franken Steve Podcast with your hosts, Dr. Frank Williams and Dr. Steve Snodgrass, MD, FACS, where we discuss a broad range of topics without limitations. Let's get to it. Here's Dr. Frank and Dr. Steve.
Hello, welcome. This is the Dr. Franken Steve Podcast. I'm Frank Williams. This is Dr. Steve Snodgrass. We appreciate that everybody's been here. This is actually our sixth podcast in the inaugural first season. So we're going to continue covering healthcare and healing and the arts, and then we'll be covering some about social media platforms and different things and physician burnout and how art and healing can effectively help them along with just general medical staff and as well as nurses, staff members and all that. So what we're going to do first is we're going to start off with going through some statistical data. I know it's a little snoozy, but then we're going to cover how art and healing can actually affect and help that. And we're going to recover some of the cost savings benefits for the art therapy programs being utilized today, as well as new research that is needed, and hopefully we can help support and get funded for studies to make it usual and customary, if I said that correct.
You got it right.
Okay, good.
Yeah, you're good.
So Steve, if you'd like to go ahead and just to mention, Steve has currently, and I'll let him speak on this, I want to congratulate him. He got an article in the American Council of Surgeons, I believe it's their journal.
The American College of Surgeons.
American College of
Yeah.
College of Surgeons.
Usual and customary.
Usual and customary, as you say. Okay. I didn't know medical terms. So, as far as that goes, it's one of the biggest honors a surgeon could get is to be featured and published in there, because currently that magazine is seen in over, I believe it's 90 countries. Is that correct?
It's 144 countries. So.
144 countries.
Yeah. So
that's a lot.
Yeah, I was very honored by that because they were featuring my art. So it's a little bit different than being featured as a surgeon, but being featured as an artist and being recognized for that, I was really pleased, and want to thank Dr. Patricia Turner. She's the executive director of the American College of Surgeons, as well as Dr. Michael Sutherland, who is director of member services, and Sophia Newman, who wrote the article. So I'm very appreciative of that. And a little bit about the organization everybody's heard about the American Medical Association and that sort of thing. The American College of Surgeons is it's an organization that's been around 110 years. And even though it's the American College of Surgeons, it has a presence of 90,000 surgeons plus in 144 countries, because again, the rest of the world looks to us to lead the way in healthcare. And so the American College of Surgeons is basically, you don't see them because they work behind the scenes a lot, but the thing about it is they are committed to surgical excellence. And so when you see that FACS behind your surgeon's name, they've been vetted. And it's quite a process, really, because like after you get out of residency, they take like your operative notes, your clinical notes, and all your records for a 2-year period, and then they have teams of people evaluate that. And so it's one of those things where you have to make the cut to get invited to be a member or a fellow. So I'm very appreciative of that, and thanks for mentioning it.
Oh, no problem. And so just to go back, because I think your article kind of, if I'm not mistaken, it kind of fits in with today's topic. So with, what surgeons are doing outside of the, OR and as medical professionals, and what are some things they do to kind of, as either a hobby or de-stressing.
Yes.
So is that what that article was a little bit?
Yeah, it covered that. And there was a mention of a physician that actually, he played the violin, but he didn't play that well. So he decided that he wanted to use his surgical skills to make violins. And so he makes violins that are used at the highest level in orchestras. So that was pretty neat. And there was another physician that was written about, and she quilts. So that's one of the things we talked about for the gallery, and that's the thing. The quilting is definitely an art. There's no question about that. But so anyway, I was very pleased to be mentioned in that, and have them cover my art like they did, because it just goes to a lot of different people that otherwise may not see it, and I'm kind of with my own peers there and my own colleagues, so it was very meaningful to me.
And it is also a motivating factor for some that may not think that they have time to do hobbies outside of surgery in those areas.
Yeah, and I think it kind of leads into one of the things we can talk about. I've got some of the, as you said, the statistics and those kinds of things can be boring to a certain degree. But on the other hand, if you dissect what the meaning of it is, and then as a result of that, what can happen, the statistics become very vital. And, you know, burnout, I didn't really know that it had like I guess it has a real set of symptoms and that sort of thing. But when you say like, oh man, I'm burned out, well, here it just means it's a stress syndrome. It's characterized by emotional exhaustion, depersonalization, and the perception of diminished personal accomplishment. And I think it hit a peak, obviously, around the COVID pandemic, when everybody was stretched pretty thin. And but at that time, and the sad thing about it is these numbers are still staying high. It's like 63% of physicians were admitted to being burned out. And I have been doing some more reading about it, and in Europe, they said that 70% of young oncologists were burned out. So, I mean, it's one thing to be old and burned out. It's quite another to be young and burned out. But, you know, the thing about it is that when physicians experience that, I mean, I think realistically, as a human being, everybody has experienced burnout of some sort. I mean, everybody has. But when it happens to physicians, you know, it leads to errors. And it's one thing for somebody to make an error. It's another thing when a physician makes an error.
Yes,
because
definitely.
You know, because there's going to be a price to pay, and the price could be somebody's life. Unfortunately, I mean, it's just one of those things that, you know, that can happen. And so, as to your point, I think a lot of people can do things to kind of break that cycle. And that's one of the reasons that we would like for people to create art or art therapy. They're a little bit two different things. I mean, art therapy is basically, you know, psychotherapy that's associated with art versus just creating art. But creating art can definitely be therapeutic. And so we invite physicians to get into that, because they have a talent to do it. Everybody has a talent to create some of the art. I mean, some of these things that you see created, you think like, well, does that really constitute art? But, you know, some it does, some it doesn't.
It's the eye of the beholder, as they say.
Yeah, but I mean, I think there was a thing I read where somebody like taped a banana to a wall or something like that, and somebody paid $125,000 for it. You know, and then somebody went and ate the banana.
Yeah, so I left the pill, didn't they?
Yeah, I think so. And I think there was a similar situation where somebody threw a McDonald's cheeseburger up on the ceiling, and like part of the pickle and bun stuck up there or whatever, and they sold that for a high amount of money. So I guess whatever you want to call art can be art, and it's, hey, if somebody wants it, I'm all for it. But back to this the burnout thing, I did look it up that 25% of those people are suspect to substance abuse, like alcohol and drugs, that sort of thing. That anything to try to numb what they're feeling.
Right.
And another very sobering statistic is that 40% of male physicians male physicians have a 40% more likelihood of committing suicide than the remaining male population. And for females, that number is 130%. So,
That's incredible.
that really is incredible that somebody gets that low to where they feel like the only out is suicide. And I think a lot of it, and I mean, I can relate to the part about, and this is especially true of surgeons, I think, is that your strive for perfection. And it's like, there's good and there's better and there's best and there's perfect. And every single time that patient is before you, a new patient, you always strive for perfection. Every stitch, everything you do, you want it to be perfect. And then when it's not, it like comes back and haunts you. Right. And there's been times where, like for me, and I can say this, and it was like one of those things I'll never forget it because it was so humbling. But I did an abdominal aortic aneurysm, which is about as serious as it gets, and I was chief resident, and I mean, and the case went. It was perfect. I mean, it was just like skin to skin, very short period of time. The case just could not have gone any better. And this is a little embarrassing, but this is why we're here. But the attending surgeon, he goes, "You really did a great job on that, and I just wanted you to know that." And I said, I know. And then you know what's going to happen.
Oh yeah.
Yeah, you know what's going to happen. So and the thing about it was a friend of the attending doctor, and this was kind of one reason he allowed me to do the surgery, because it was a personal friend of his and all that sort of thing. And so it was a big deal. And then so like it was about 3 o'clock in the morning of the day of the surgery, and I'd seen him probably about 9 or 10 o'clock that night in the surgery intensive care unit. He was doing fine, and I went home. And then about 3 o'clock in the morning or whatever, I get the call that, he's in cardiac arrest and all that sort of thing. So the first thing I think of is just going like, did you ever jinx yourself or what? Don't ever do that again. Never do that again. And so anyway, the patient had a blood pressure of like 400 systolic, and they were giving him every drug you could give him to knock that blood pressure down, but they just could not get his pressure down. And a blood pressure of 400 on a fresh suture line does not bode well. So everything explodes. And his heart, he has a massive heart attack, and the suture line explodes, and he dies, and the family's crying. And then the surgeon looks at me and he said, "Do you remember your statement?" And I said, "I absolutely do." And he said, "It always comes back to haunt you every single time." And I said, like, I will never say that again, ever. But back to the point is that we strive for perfection, and when you don't, even though that surgery was perfect, the results were horrendous. And it was just one of those things. It's a known complication. I mean, the guy had a lot of cardiovascular disease, or he wouldn't have been there in the first place. So that's what got him in trouble beforehand. But and he had a ruptured aneurysm, and something that he could have easily died before he made it to the hospital. And so everything just clicked and it went well, and like, oh yeah, I mean, this is fine. This guy's going to do fine. I mean, he's got to be in the hospital for a while, but it's going to work. And then that night, it was kaboom, really. And so I never forgot it. And
I bet.
yeah,
That'll take you down a few notches, huh?
it will. It will kind of say like, well, you need to sit down and reevaluate things a bit, and just if you're gonna be bad, you really got to be good.
Yeah.
So, but one of the things that about art therapy and just creating art in general is that it's being used by therapists to treat the burnout, to treat physician burnout, and they said like the literature said like there's 10 different kind of treatment areas, but art therapy was in the top 4 every time. So art therapy has a place not only for patients, but it has a place for caregivers as well. And what's interesting is that yes, it's happening to doctors, attending physicians, and those doctors who are in private practice. But it's I just call it like a trickle down effect, because the burnout, that high burnout rate, is also being seen in interns, residents, fellows, medical students, and actually at the pre-med level. So, we're talking about stress and anxiety and that sort of thing. And that goes along with the turf. But I don't think I've ever seen numbers this high where it's been covered in the medical literature like it's being covered. It's like through the Journal of the American Medical Association, that they devote like entire sections of the journal to physician burnout and some of the things that can be done. But art therapy is really good, and the things that there's 10 things that they listed that art therapy does. It reduces stress, anxiety, and depression. It helps you process and express your emotions better, and it will also enable you to connect with colleagues and obtain new perspectives and personal insight. And enables creativity, rejuvenates, it improves self-care, increases patient empathy, which I think is very important. It also improves just the overall quality of life. And I think the patient empathy thing is very important, because it's so easy to get lost in the fact of you're treating numbers, you're treating X-rays, and that's actually a person there. Well, we understand that and everything, but you can get so busy and so lost in all this minutia that you forget that that's an actual human there, and it does hurt to have surgery.
Well, it's just like, I trained other MDs that are practice students and friends of mine, and in hand-to-hand combat and martial arts. And a couple of them in particular, when we start discussing this, because they'll bring it up and say, Medicare's cut costs again. So over the last few years, especially since COVID, Medicare has been reducing their cost for like reimbursement by up to, it's a little over 20% now, I believe, is according to, online stats and according to these physicians who run either their own private practices or are part of a group practice. And you may have some numbers on this, but they were telling me that there's a shortage of doctors because internal medicine doctors are not being replaced at the level at which they need to be replaced. And not only that, they're also not gaining internal medicine doctors or family physicians at the rate which they need for the influx of new patients that are coming on board. As baby boomers get older, we have illegal migration of millions upon millions. So there's not near enough doctors, and I think a friend of mine, John, said, the rate is running about 10% a year, and that's a lot when you think about the number of doctors that are out there and who's going to be seen and who's not going to be seen. And so doctors are carrying loads. Like he would have loads some days in his family practice of anywhere from 32 to maybe 40 patients a day. That's a lot of patients for a doctor. And like you said, the empathy's not there. You're under the gun to try and get everybody seen that you can get seen. And You know, it only takes a couple times for there to be a slight slip up because you're so busy and burned out, for them to even exacerbate that burnout rate, because, you know, they're just going to feel like it's a never ending cycle. And no matter what they do, they're just never catching up.
Yeah, and I think to your point, and I don't think this is covered near enough, because I think a lot of people consider it taboo, if you will. But physicians' pay is continuously being cut, and everybody thinks like, oh, big rich doctor or something like that. You know, I can tell you this: if there's anybody, if there's any lesson to be learned at all from somebody watching this, if you go into medicine because of money, then it's one of the stupidest things you can possibly do.
Right.
It's one of the stupidest things you can do, because it's like, number one, well, most of them are in debt, a couple $100,000, and then you go to med school, and all of this is like, it's not like you're paying a couple $100,000 for a party. I mean, you're going to med school where it's just really quite a drain on your mind and your body and your spirit, that sort of thing. Then you get out and you do what you do. Like for me, you know, I went to 4 years of undergrad. I did a year of postgraduate training at Washington University in St. Louis, and then I went to medical school. That's 4 years. That's 4 more years, and then surgical residency, internship and residency. That's another 5 years. And so by the time I got out, you know, I'm like 32 years old, and I'm just looking at it like, you know, this
14 years later.
It's like, you're so young, you don't even think about it. But one thing that that really got me one time is just like, it was kind of like along the lines of what happened to this other guy. But I had a person who came in with a ruptured, what's called a suprarenal abdominal aortic aneurysm. So the aneurysm was above the blood supply to his kidneys. And he also had lack of blood supply going to his legs. So I had to go in and fix the aneurysm. I had to go repair, get that, and put a graft in. But I had to do a jump graft to both kidneys and then graft to both legs. So, I mean, I essentially rebuilt his vascular system from above his kidneys down to like his knees. And that's a lot of work. That's a lot of work, and not to mention just the post-op care and trying to get, and he survived, and he did well. He flourished.
Not something you can get off a YouTube video.
No, it's like how to. No, it's not. It's a little more complicated than a carburetor, with all due respect. But, you know, one of the things that got me was like, I just asked my office manager, I said, you know, when the payment comes in for that, let me just see what that is, what the Medicare payment was. And I looked at it and I was like, that's really, really just bad, because I was in the doctor's lounge and I was listening to another surgeon, and he said that what he charged for doing like Botox and everything is just like, he got more money for a Botox injection than I got for rebuilding an entire vascular system. So I just kind of like, you know, there's something about that just ain't right.
Yeah.
But it, you know, it's the way of the world. But I think that I think physician pay is a critical factor in burnout, because, you know, it's there's a lot of people, it's like work hard, play hard kind of thing. And if you work hard, a lot of times you want to play hard, which is fine. But if you work hard, don't play, it kind of gets to you a little bit.
That's true.
And I'm not looking for any kind of sympathy. There's nobody going to give me any anyway. But I'm just saying there's a lot more ways to make money easier than medicine. I truly believe that it has to be a calling of some sorts to you, that like, this is what I want to do, because I knew when I was a kid, I knew I wanted to be a doctor, and for whatever, I just knew that's what I wanted to do. And I never, there were a couple times I deviated from it, but it was something related. At the time, there were, the college I was attending, this was right when the FBI was doing like psychological profiling and all that sort of thing. I was going like, that could be pretty interesting. And so I was looking at it, but that would have required me going to like the medical school and going into psychiatry and all that sort of thing. And I just looked at it going like, could be an interesting thing, but I'm just going to stick with the original surgeon plan. And so that's what I did. But I think that at some point we can delve more into this burnout, because I do think it's, they're calling it an epidemic.
Oh, I imagine hearing how many physicians are retiring, and not counting the number of nurses. Where there's always been a nursing shortage, and those medical professionals that help make up the whole entire family physician office, from staff workers to it's phlebotomists or whoever it might be. If I said that correctly,
it was close enough for me.
Okay, so whatever. Like I said, I didn't know medical terms. When you look at that, and even training them over the years and seeing how stressed out, nurses can become, physicians, even those that are non-physician but work in the medical community, there's a lot of burnout, and it's because a lot of people are empathetic, and and they're good people, and they care about the people that they see and around, and sometimes the busier they get, the more helpless they get, and then there's no outlets, and with today's I don't want to say social political climate being what it is, it's just hyper accelerated for them to get burnt out quicker, according to studies, because of everything they're going through. And so, everybody hits strides, as you said, like surgeons. They want to be perfect. They want to be better, faster, be able to create, be able to, function faster, get more people seen. As medicine progresses and advances, that can be a major benefit. At the same time, can be a detriment, because, a lot of times, as we've discussed in previous podcasts about, physician versus non-physicians, if you have to start utilizing non-physicians, which are, again, nothing wrong with that, because I love the ones that we have for our family: nurse practitioners, physician's assistants, maybe a pharmacist who, thinks they should be able to treat people. Ridiculous. Whatever that, no offense, but whatever that is, again, I always come back to this, it kind of leads the U.S. into gearing towards socialized medicine. And so that's not a good thing, because you need people to be able to know the roles, be able to do their jobs, but you also need that person that's been to medical school, whether it's a specialty or internal medicine, no matter what it is, you want that MD or DO behind their name, so that if crap hits the fan, you're actually with someone, or someone's available to be able to handle your situation. And so, that's, and I always wonder, does that stress of allowing, and then again, we'll get into that in another podcast about burnout, does that stress of so many non-physicians creeping into the physician environment and replacing them literally, does that also add to burnout, because physicians feel like they're not appreciated as much? And that's another reason why Medicare, Medicaid, all this can cut down on the amount of money, is because they figure that someone less qualified can do that, and that's not good for a healthy community. It's not good for a healthy nation.
No, I mean, there are elements of all that. I mean, this is like a giant pot of stew, and there's plenty of ingredients that lead to this problem. And the one thing too that I always like to tell the story because they've got it now, I think, where for people, the residencies are supposed to be limit their training to 80 hours a week or something like that. And I remember, which, we would work 120 hours a week, many times, most of the time. And I remember for me, I had my colleague, he had to take an extended leave for a period, so I took his call for him while he was on a family emergency getaway that he just had to be there. And I was getting towards the end of my call responsibility, but it was like, for whatever reason, it was I went in to the surgery suite and I looked at the hallway, and the hallway was, all you could see were gurneys of patients that were getting ready to go into surgery. And so it's like, for me, I went back and timed it. I mean, I had a couple of bathroom breaks, and then I was eating a cheeseburger and drinking a Coke on the way up the stairs. But other than that, I was in the OR for 67 hours. And my last case, because it's amazing how fate, the universe, or whatever it is gets you. But my last case, and I'm already like pretty well exhausted. Let's call it. I am just totally just whipped out. But my last case was a gunshot wound to the axillary artery, and we had to go. It was about that close from retracting back into the chest, where we would have to just fillet the chest open to make the repair. But we were trying to make the repair through the armpit of the axilla. So that's a much smaller incision. It's much smaller enclosed space where you've got to work. And then I'm wearing these loops that magnify everything 5x. And you're sewing that axillary artery back together with suture that's as fine as a human hair. And so, like, that's my last case of the 67 hours. And I remember the chief resident, he looked at me and said, "Do you think you probably had enough for a while?" And I said, "I think this was going to do me for a day or two." So, yeah, so all of that is very real. And but what we want to do with art and the invitation to come to the William Snodgrass Art Gallery is that we want to encourage creativity.
Yes.
And there is absolutely no question that creating art will bring you peace. There's no question about that. I mean, it's just proven over and over again, and I am an absolute living example of it, because a type A personality, I don't know if that would describe me or not. Probably not. But anyway, it's like I really did find, and still do, thankfully, find peace in creating art. And so I think that no matter what that is, if it's sculpting, drawing, sketching, quilting, whatever it is, photography, I think that you need to have a break from medicine. And I did not really have that much of a break from it when I was doing it. I took time for my kids and my wife and that sort of thing. But other than that, it was pretty much full-time surgeon all the time. Yeah, and it was, to me, I look back on it, I could not really enjoy myself like on a vacation or something like that. It's just like one of a dear friend of mine, actually. She had breast cancer, and I did a mastectomy, and I was due to go on vacation. For her, it would have been post-op day 2. And so I checked on her. I said, "Hey, the wound's healing great. Everything's fine. I'm going to leave, your care to my partner. But, it's just one of those things I just have to do." And she started crying and that sort of thing, which made me feel even worse. But for me, I had trouble breaking away from it, and it's just like, oh well, I took out your colon, and I'm going to go to Europe and have a wonderful time. I could not do it. I couldn't do it. I could do like weekend jaunts or something like that, and then I was ready to come back to work, and I can't do that over, but I was really dedicated to my craft when I was there. So if I had it to do all over again, I would have to say do the same thing, because I was committed to my patients and in every aspect of their care. But back to this whole thing about the art therapy and creating art, I think one of the things that we are discovering, we're shining a light on it, is like, yes, it's great for patients because they are enduring tremendous suffering. We understand that, but it's also for the caregivers and who are suffering.
Right.
And so I think that aspect needs to be looked into more. I think there's more research that needs to be done, because if you can prevent somebody who's you don't want anybody committing suicide, but somebody like this that's very talented in committing their lives to helping other people, that sort of thing, and they become so desperate that they feel that suicide is the only out. And so if we can institute this way of thinking and say, like, you need to step back, you need to create, and then if they could create art and then sell art, I guarantee you they are going to feel better. It is going to be rejuvenating for them, without question. And so, but I think that more research needs to go into that area, both on the patient front as well as the caregiver front. And you're a veteran as well as a law enforcement officer, same kind of thing. I mean, the stress that you endure.
Yeah, first responders, it's huge.
Yeah, I mean, the stress that you endure. And you have to keep quiet about, and you can't really bring home with you and that sort of thing, and talk to your family about it. So you have to carry that inside, like we do.
Right.
And so it's one of those things where I think first responders, that obviously include the police and the fire department, EMT, all that sort of thing. All of this in this healthcare arena, I think stress level has never been higher. I don't think it's
no, absolutely. That's statistically proven.
Yeah.
And so yes, and our goal, like you said, is to make it usual and customary. But until that time, finding ways and doing studies, appropriate studies, to help you, because it's no doubt everybody has a creative outlet, no matter what it is. Maybe the oddest thing in the world, but you still have a creative outlet that to de-stress your body. And the thing is, the William Snodgrass Art Gallery and what Steve and I are doing, we want to use something that we feel is vastly underrated, underused right now, which is art therapy.
Absolutely. And there's a lot of art that's created and then it's just tossed or lost.
Or stored, yes.
And it's like, and to me, that could be some of the most vital art that we're not seeing, because behind all of that, and that's part of the art therapy thing, there is a story to tell. And what is that surgeon or what is that oncologist, what are they thinking? How are they thinking? Or that cancer patient, or a child, or a sick child that creates art that really can't express themselves very well except through the art. And to not have that art seen, that's a shame, because that is the most visceral, raw, real art you may ever see. And so that's one of the things that we want to shine a light again on it, display it, and give people a chance to look at it and buy it if they want to buy it.
Absolutely. Well, it's been a great discussion, and we'll come back and we'll have other podcasts on physician and as well as healthcare workers, first responder burnouts, and the things we can do to help and push forward in these areas, along with the studies that we would like to see done. So we want to appreciate, or I should say, I appreciate the fact that everybody's still with us, and so does Steve. We look forward to seeing you at our next podcast. And if you have any questions, remember support at drfrankensteve.com, or you can contact us at the williamsnodgrassart.com. Any of those, if you have any questions, comments, concerns, whatever it may be. We appreciate it, and we'll see you next time.
See you. We'd love to hear from you.
Thanks for listening to the Dr. Franken Steve Podcast. If you enjoyed this podcast, please hit follow or subscribe on the link provided so you can stay up to date on new episodes. Until next time, stay healthy and stay safe.